Hi, my name is Pamela Langan, and today I'll be providing a situational analysis regarding post-operative pain assessment and management. Post-operative pain is a multifaceted, multidimensional experience which involves a range of sensory, cognitive, psychological, physiological, and sociocultural magnitudes. Post-operative pain tends to be caused by nociceptive pain or tissue damage, which often results in unwanted sensory and emotional experiences. Effective acute pain management has been proven to have significant psychological and physical health benefits for the post-operative patient, even for long periods after they return home from surgery. Poorly managed pain post-operatively can drastically delay the healing process and is associated with potentially life-threatening risks, including long-term chronic pain, disability, and severe respiratory illnesses. Inadequate management and assessment of pain is one of the main reasons as to why patients suffer from prolonged and unwanted pain post-operatively. Pain-related mismanagement also exposes patients to adverse opioid effects, psychological upset, and potential transition of their acute pain to chronic pain. Healthcare facilities are also more susceptible to financial and staff-orientated strain due to prolonged hospital stays and financial costs of medications and therapies. Available data suggests that 75 people out of every 100 people experience some form of moderate to severe pain post-operatively. Between 2017 and 18, 2.7 million people required surgery in Australia, including both emergency and elective admissions. In addition, people aged 65 years and above accounted for 42% of hospitalizations. Patients often report experiencing inadequate pain management and inconsistent practices during the post-operative period. On average, chronic pain occurs in 10% of post-operative cases in Australia. There are various tools to use when assessing a patient's pain. In Australia, the behavioural pain scale is a great option for patients who are intubated or are unable to respond to verbal commands. It uses a range of objective data points that enables a healthcare professional to estimate the amount of pain the patient is in. The numerical rating scale is another tool used to assess a patient's pain, 0 being no pain and 10 being severe. The numerical rating scale, in combination with other pain assessment tools, has been proven beneficial in achieving a holistic assessment of the patient's pain. The numerical rating scale is included in a SAGO chart, allowing nurses and other healthcare professionals to monitor the patient's pain levels using the between-the-flag system, whilst following the various other trends relating to pain, such as their vital signs. Using the numerical rating scale within the PQRST assessment is also beneficial as it gives the healthcare professional more information regarding pain and the patient. Asking a patient about the provocation, quality, region, severity, and timing of the pain allows the healthcare professional to understand the patient's pain on a considerably deeper level. Post-operatively, there are a range of pharmacological and non-pharmacological therapies to relieve pain. Intravenous patient-controlled analgesia is a piece of equipment in which the patient controls the amount of pain relief they receive, within preset limits on the device. This form of pain relief gives the patient more autonomy and allows them to determine when they may need more analgesia. Nurse-controlled analgesia is another method of delivering pain relief to patients who are deemed unsafe or unable to control their own device. Nurse-controlled analgesia is similar to a PCA, however the nurse controls the button instead of the patient. Multimodal analgesia is a highly recommended method of post-operative analgesia. Multimodal analgesia combines analgesic drugs from various classes that target different mechanisms of pain, resulting in maximized pain relief in lower doses of analgesia, thereby reducing the risk of unwanted effects. Various non-pharmacological therapies for pain also exist, including heat therapy, such as a hot water bottle, cold therapy, such as an ice pack, and relaxation strategies. These therapies, in combination with pharmacological therapies, offer the patient a successful road to recovery. Due to cultural differences, age differences, and generalized holistic understandings, a patient's pain is often more complex than a number. An example would be if a child states their pain level is a 10 out of 10, they may actually have the same amount of pain as a child who states that theirs is 6 out of 10, due to different understandings of the anchors within the pain scale. A study conducted with Aboriginal women experiencing post-operative pain also found that the numerical scale wasn't sufficient, as many of these women did not recognize numbers higher than 5 due to their local Indigenous languages. As pain is subjective, it is different for all patients. Using one scale or a single digit to describe the pain can often have its downfall, especially with culturally diverse patients in a healthcare setting. Patients may not understand the assessment in depth or may be experiencing pain at a greater level than physical. If pain is assessed incorrectly or mismanaged, patients may have less chance of a full recovery and greater health risks in the future. Inadequate education for both healthcare professionals and patients is another barrier to enabling quality post-operative pain assessment and management. Lack of pain education can result in opioid misuse and further risks surrounding pain management. In addition, healthcare workers who are inadequately trained in pain management and assessment have the potential to do more harm than good with their patients. The World Health Organization recognizes patient handover as one of the 5 challenging safety problems amongst patients. Poor handover of patient information can have damaging effects such as delayed diagnosis, repeated tests, incorrect treatment, and medication errors. Due to limited funding worldwide, the nurse-to-patient ratio within hospitals can often be stressful, and many nurses may feel it is impossible to complete all tasks to the highest standard. Implementing thorough pain assessments and management is something that Australia is constantly working towards. In reality, healthcare professionals may not have the time or resources to conduct thorough pain assessments with every single patient, potentially resulting in higher financial costs for hospital and healthcare settings. My main suggestion towards bridging the gap between research and practice would be to implement the standardized ISBAR handover at every shift change. ISBAR is one of the most effective, simplified, anticipated, and structured form of communication between healthcare professionals. When performed correctly, the ISBAR method of handover ensures that the patient's safety is not compromised due to miscommunication error. Another suggestion to bridge the gap would be to educate both nurses and other healthcare professionals about the importance of holistic pain assessments. This could be achieved through in-service sessions during shifts, online modules, or even educational leaflets. If healthcare professionals are able to understand the importance of an in-depth pain assessment and the risks associated with mismanaged pain relief, they may feel more encouraged to engage with the patient and gain a deeper understanding of the individual's pain. The importance of post-operative pain assessment and management goes beyond numerical scales and medication administration. Through greater education amongst healthcare professionals and patients, appropriate handover methods, and thorough pain assessments, we may be able to bridge the gap between research and practice, and patients will have a greater chance of a full recovery from the post-operative setting. Thank you.